Everybody's pouring in. I love it. Share my screen. All right. Can everyone see my screen?
Yeah. Yes, we can.
Awesome. Thank you. All right. Well, welcome everyone to today's Behavioral Health Advisory Group monthly meeting. We will get started in just a second. We have a couple more people pouring in. So if you just need to grab some water, a quick snack, feel free to do so at this time. We'll get started in like 30 seconds. And then I'll ask Miss Margaret Fowler to give our official welcome. In the meantime, feel free to type your name and organization in the chat box. Okay, Margaret, do you want to get us started?
Sure. Just want to welcome everyone here today and thank you for giving us a little bit of your time this afternoon. As Shanae was saying, you can please enter your name and organization in the chat so we can have a record of who is on the meeting, and that the meeting will be recorded for those who may not be able to attend. So just again, welcome to this BHAG monthly meeting, and I'm glad you're here with us.
So if you want to, yeah, go ahead, Margaret. It's okay.
Yeah, I was going to say for the icebreaker today, if you want to introduce yourself, if you are someone new here for the first time, you can give us your name, your organization, and then finish the sentence. I know it's autumn when. No, it has been rainy lately, but autumn means what to you guys? So I know it's autumn when. Fill out that statement.
And you can write it in the chat box, or you feel free to speak out. And this is for anyone to participate.
Yeah, I'll get us started for the opening of on speaking out. I know it's autumn when there's the really cool mornings when you wake up and you need that sweatshirt, but by the afternoon it's a little bit warmer. So that's what I like. And then also, like you can see here, the leaves start changing. I have a fire bush in my yard and it's starting to turn bright red.
I love that. We have some comments in the chat that says, when the leaves are falling, when the weather is finally tolerable. Julia says, when it's football season, yes, go Birds. And Dr. Coleman says, when the leaves start to change colors.
And when I saw pumpkin spice.
Yes. Nina says she knows it's autumn when the mountains are calling. Yes. I know it's autumn when nature creates its own beautiful canvas. That is so poetic. I love that. Would anybody else care to share or introduce themselves? Ziamara says,
hi, everyone.
Oh, I'm sorry. Go ahead.
I'm new, so I wanted to introduce myself,
Yes.
if that's okay. I'm Raisa or Raya. I'm with Food and Friends. If you knew Casey Dyson with Food and Friends, I'm the new Casey. So I just wanted to introduce myself. Thank you all for having me here. And I know it's fall when the pool closes, and on the last day of pool day, all the dogs are allowed to get in and swim.
Oh, wow. That's really cool. Welcome, Raisa. Good to see you again. Ziamara wrote in the chat, she knows it's autumn when the stores have Halloween, Thanksgiving, and Christmas decorations all at the same time. It is a very confusing season. It's a hard time to shop. Let's see. Belinda says she knows it's autumn when she goes to buy her mom's golden orange, beautiful color. And I see Denise Dunbar says when it starts getting cold. Yes. Yes. Russell, he knows it's autumn when the Eagles are playing. Yes, go Birds, fellow fan. I love it. I know I like this work group. Awesome. Well, thank you so much, everyone, for introducing yourselves, for typing your name in the chat box, and for sharing a little bit about what you notice most about autumn, what you love most about autumn. And I think autumn officially starts next week, or is it this week? Can't
I think
remember.
it's Tuesday or Monday or Tuesday, the 22nd,
Yeah.
I think.
It's coming. So whether we're ready or not, it's right around the corner, right? So thank you all for being here with us today. So now that we've had our welcome and introductions, I just want to just really quickly just review today's agenda. So up next, we are actually going to have 2 Partners in Focus presentations. And this is just our segment where we put in a focus, or we really just highlight the various partners of BHAG who are going to share about their organization, the work that they do, and how we can find ways to best engage and support each other. So after that, we will then have a presentation about the Prince George's County System of Care Grant. Some really exciting work is going on, and so we want to make sure that we always extend the invitation to share all that's going on in our county. And then we will end today's meeting with some community announcements before. And I will preface by saying there are quite a few community announcements. So just bear with me, but it's a lot of really great things going on in the county that I just want to make sure that I'm sharing with everyone so we can share with our partners and with our community members as well. All right. So at this time, I'm going to ask Carlos McCall to introduce our first partner in focus for today.
Sure, thanks. So I'm going to introduce Shatia Blunt, who is a LCSW, licensed clinical social worker and prevention scientist committed to preventing and reducing the impact of psychological distress, mental illness, and behavioral health disorders within Black communities through academic research, impactful training, education, and awareness in clinical services. Dr. Blunt is the founder and owner of I and Me LLC, a social enterprise dedicated to elevating Black minds through mental health by providing culturally relevant psychotherapy services and by facilitating education and training to develop and diversify the field of mental health professionals. She is also the author of the Clinical Social Worker Supervision Notebook, a comprehensive workbook designed to help social work and psychotherapy trainees organize, document, and structure their supervision sessions effectively. Published March 2025, it is a one-of-a-kind resource and essential companion for clinicians to streamline their supervision process and take charge of their professional growth. Welcome, Dr. Blunt. Very happy to have you here.
Thank you. Thank you so much. Very happy to be here. Good afternoon to all of the BHAG members. I have a brief presentation that I will give. They gave us a 5-minute time marker, so I'm going to fly through, but please feel free to ask me any questions if you have them and the time allots, okay? I am going to try to share my screen here. I typically work in Google Drive, but these slides were made in PowerPoint. So I am going to do my best to share the right thing with you guys. Are you seeing the slides as in like a presentation view? I can't see you.
Yes.
So, okay. And you're not seeing all the back end stuff, correct?
Correct.
Okay, great, I did it. So yes, nice to meet you all. I'm Shatia Blunt, the founder and owner of I Am Me LLC, where we seek to elevate Black minds through mental health and really foster mental health and wellness across the global Black diaspora. We emphasize the Black diaspora because one of our major claims or facts is that, oftentimes when talking about Black folks and mental health, Black people are looked at as a monolith where there are a lot of cultural and ethnic differences across the diaspora. So that is our niche and our focus. And so given that, we are really working to address a significant public health issue where only 1 in 3 Black adults in need of mental health care actually receive it due to a shortage of culturally responsive professionals, hyper focus on emergency treatment and not prevention, and some other reasons around trust and distrust in the healthcare system. And so really we aim to create easy access to culturally responsive therapy for Black folks and adjacent communities, promoting its use for prevention, treatment, and some emergencies. And some emergencies is highlighted here because what we know from working in Black spaces, what sometimes Black folks don't know when they're in an emergency. And because it's not, it hasn't elevated to an acute crisis, the hospitals and such are not called, but there are some preventative things that we can do when they are actually in an emergency to prevent it from escalating to something that's acute. So overall, our ethos is we practice culturally humble and social justice informed in terms of our approaches. We are a values-driven organization, and so we really seek to minimize societal harm in every aspect of what we do. And we prioritize mutually beneficial experiences, ensuring services are affordable and accessible, and also thinking about how we treat our staff, right? We sometimes we think in this work it has to be full of sacrifice, and we try to really find the win-win paradigm, especially in terms of, you know, making sure that things are equitable and fair. Our core values, so we acknowledge resilience, acknowledging both strength and pain. We do believe here that a lot of times resilience-focused interventions are really placed upon folks of color, but particularly Black folks. And we really like to acknowledge the pain as well, because it is there and not hyper-focused on resilience. We value lived experiences as valid evidence, really challenging the idea that evidence comes from the ivory tower oftentimes, but you know, people are experts on their lives as well, and we act as partners in that. And then we view therapy as an act of self-love and advocacy, especially when we are working in communities that has a history of sacrificial love. We have to help people to understand that taking care of yourself is taking care of others. So our core support pathways, we have a practitioner pathway, and then we have services, direct services to clients. So our services to clients is therapy for the strong friend, where we provide highly personalized and quality psychotherapy for Black adults who are leaders in their families, communities, and workplaces. And that's a very broad, defined very broadly. We have clinicians who specialize in grief, queer mental health, Black men, that's not listed here, EMDR, et cetera, et cetera. We also have a launchpad for therapists, which is a guided coaching program to really address the issue of the providers shortage in helping therapists to be able to start their private practices and operate in ways that feel aligned with who they are, because sometimes, you know, there's some level of stifling when you're not able to do that. And so we support folks in being able to design and launch their mission-driven private practices. And we cover things from foundation building, legal, financial strategies, ethical practices, et cetera. And also we have our business incubator for therapists, where therapists come in and work under IME's brand while they build their own practices. And they're taught business acumen and also clinical skill to help for a healthy transition into entrepreneurship, really trying to build the workforce of culturally relevant practitioners who also have business skill, because for those of us who may come from the social work tradition or any other psychotherapy tradition, we know that we don't necessarily get business skill in our academic preparation. So next, in the introduction, we spoke about what you all became aware of, the Clinical Social Worker Supervision Workbook, which really is something that I created to really help people, social workers in particular, to learn how to ask the critical questions of themselves that will help them to become very good clinicians. As a social worker myself, I do know that I and a social worker who has worked in the academic spaces, I know that we are also often very prepared to be amazing case managers. And we come out and sometimes we want to do clinical work, but we have the heart, but not the skill. So this is really to help folks to develop the skill early on in their training, so that they don't have to, you know, wait and get it later, and minimize harm in the process. With that, there's a prompt card. There you can buy this standalone, or it also comes with the book. There's 37 prompts that covers all different areas: critical practice evaluation, ethical practice, professional development, social justice, et cetera. And so what I wanted to highlight here really in my 5 minutes, I don't know where I am with it, I think I maybe have a minute left, is our Wellbeing Works Employer Program, where we provide culturally responsive workplace mental wellness. So really thinking about the president's big, beautiful bill and how at the end of the year, the not the stipend, but the people who have to pay for health insurance through the marketplace may lose their subsidies. And so, and also those who are in the Medicaid population may also lose access to healthcare. I'm thinking about those who are employed or underemployed, or maybe working in environments or in healthcare professions where they are not necessarily getting the mental health and workplace well-being support that we see in some of our corporate areas. I really wanted to think about how small businesses or small healthcare practices, et cetera, can offer a service to their staff to be able to help manage burnout and issues of absenteeism and overworking and all these types of things. And so it is designed to be a support or an extension of a EAP program, where the employer can purchase time blocks of mental health services from IME, where their employees can access on a walk-in basis. And so they'll get access to expert therapists. We use a single session therapy model. So you could have one therapy session and be done, or you could have 10 and be done, depending on what the organization has contracted for. And also we help with warm referrals into the community, and really focusing on Black employees and Black adjacent employees who are working in the community in direct care. And so that is about the size of it. The announcements or the meeting notes will have more information about the workplace well-being program. But if you really want to know more, you please feel free to contact me. Here's the QR code here where you can send us an email or fill out our contact form, and I'll contact you. And then and hopefully, our overall vision, as mentioned, is for Black communities to have access to culturally responsive psychotherapy and to feel comfortable utilizing it for prevention, treatment, and emergencies if needed. So please feel free to reach out to me if you want to align with that vision in any other programs that I spoke about today. And with that, I'm all done. Thank you.
Thank you. All right. All right. So now, Carlos, if you are still with us, do you mind introducing our next partner in focus?
Sure, I can do that. Dr. Kenya Coleman is the founder and chief executive officer of Kaleidoscope Wellness and Education Group, LLC, a mental health organization dedicated to supporting whole school communities through trauma-informed, equity-centered practices. With over 20 years of experience as a licensed independent clinical social worker and doctor of clinical psychology, Dr. Coleman has led large-scale school-based mental health initiatives at the student micro school and community, meso, and district state macro levels. She has extensive experience in crisis response, professional development for school-based mental health providers, and creating culturally responsive therapeutic environments that support students, families, and educators. Dr. Coleman is committed to innovative approaches to expanding access to mental health support and strengthening the capacity of entire school communities with a focus on underserved and marginalized youth. Welcome, Dr. Coleman.
Thank you for that. Every time we've been doing this for 5 years and I still struggle to unmute myself. Thank you for that introduction. I do greatly appreciate the introduction. So most organizations in this space do one or two things. They either provide mental health services or they offer educational consulting. What sets Kaleidoscope apart is that we do both. We are mental health consultants who focus on schools, and that means that we're uniquely positioned to support students, families, and educators and systems all at one time. And that can be a little bit confusing. How does all of that work? A few examples. Right now, we have a partnership with Bowie High School, where we are pushing into that school and literally providing a shared language for students, parents, and educators. So right now, Bowie High School is utilizing Sources of Strength um, as their primary mental health care provider, and Sources of Strength really leans on a model adapted from SAMHSA's domains of wellness. And so what we are doing is we are taking that very same language and helping the adults, both the parents and the educators, understand what the domains of wellness look like for them, how they can lean in into the areas where they need additional support so that they can be well and support students. That's at the individual level or the school level. We are also supporting more at that meso level, right? We are supporting Cecil County Public Schools with making sure that their schools have thriving MTSS practices. MTSS stands for multi-tiered systems of support, and that just means that we are making sure that whatever the level of need that our students have, whether it's like intense individual support, whether it's group-based services, or if it's something more universal like a reward system, that we have a standardized way of doing that across schools. And we also have a contract right now with the state of Washington where we are helping the state make sure that they are putting in place practices to close the gap and making sure that they're um, I'm going to say achievement gap because that's what most people are used to hearing. But the rates of disproportionality between what African American students receive and other students receive, and students from other groups. I don't want to just call out African American because those are not the only areas where disproportionality exists. But what I am trying to emphasize is that we do that at every level. So we provide mental health, we provide educational coaching and training. And again, we integrate that throughout every level of the school system to make sure that our students are holistically supported. This work comes out of my previous work as the Senior Director of School Mental Health for District of Columbia Public Schools. I had the absolute blessing to do that during COVID. And one of the things that I learned during COVID is that if our children were to be well, the educators and the parents, ultimately the caregivers, had to be well also. And so it was important to me that we did not work with our students in silos, but that we made sure that mental health was integrated into every level of their interaction. So that's them as individuals, their families, and then their larger communities. And so how we can support the BHAG, right? So there are people from many different levels, organizations, lenses that all comprise the BHAG. And one of the things that we would really love and ask you to do is to help us to share this concept of a dual role model where we aren't just doing one thing as our um, logo shows. I'm not sure if you guys can see this or not, but we are the sum of many different parts. And we cannot divorce ourselves from one part if we are to be holistically well. When we show up in the school building, when we show up at work, we show up with all of who we are, right? And that means that if we are working with people, we really have to support all of them and not just a fraction of them. That is the emphasis of Kaleidoscope. And so we would like for you to share this particular model. We will be looking to the BHAG to help us to create opportunities to pilot our integrated approach throughout Prince George's County. And we are also looking to have a voice in advocacy conversations where both mental health and education are at the table. Conversely, we are more than happy to lend our expertise to the BHAG again on how mental health and education intersect in real time. We are happy to support organizations, individuals as it relates to sharing strategies for building whole person development, trauma informed development. And lastly, we look to partner or to offer thought leadership on workforce development and systems change. Comparable to Dr. Blount, we do have a one pager that dives a little bit deeper into the services that we provide at the different level and how you can interact with us. One thing that you can do right now, or one thing that we would like to offer right now, is that we do have our K-Scope Wellness and Education app. It is a one-stop shop for all things mental health. It is meant to be a safe space where our young people can go and explore what mental health is versus what mental illness is. They are two different things, though we use them interchangeably. If they aren't sure if they are sad, for example, versus clinically depressed, those are two different things. They can go into the app, learn more about clinical depression. They can even take a screener to find out if they meet the qualifications for depression. They can get free strategies and skills that they can use right now at home and school. And if they want to meet with a mental health care provider, they can also schedule an appointment to meet with a mental health provider. And so right now, the Kscope app is available in the public domain on both the Apple Store and Google Play. And we will be sharing that information also in the chat with you. So at this particular time, Shanae, I'm not sure if I have any time, but if I do, I'm open to taking any questions.
I think you have 1 minute left.
Okay.
Looks like there's a question in the chat box. Oh, I think this is just general. Sorry.
No problem.
Oh, Shanae, this can go to Dr. Coleman. I was curious, Dr. Coleman, you talked about Kaleidoscope's role in policy advocacy and trying to see with mental health policy and its intersectionality with students. I'm curious if you're tracking anything from the 2025 policy season or the upcoming 26 policy session, or if any of our partners on the call are looking into any mental health policies.
So we have some partnerships right now, again, with Cecil County and with the state of Washington. We aren't doing any tracking that we will be reporting out on, I should say. With Prince George's County, we are aware of it based upon our lived experience, but we aren't tracking it in a way that we are going to put out any research on it. Did I answer your question? Or does it really matter if we're doing the research or if we're just doing it for our own understanding so that we can better support students?
Yeah, I was just curious in general, in the policy advocacy space, if, there were any policies that you wanted to bring up to the BHAG. I know, Dr. Blunt, you have brought up a few policies to the BHAG to try to rally support. So just wanted to offer up this resource in this group. If there are any policies that folks want to bring up and have comments or digest as mental health professionals.
Yeah, I'm right there with Dr. Blunt. The one thing that is really at the forefront of my mind is effective December 31st of this year, the subsidies that people were getting through, what is it, the Maryland marketplace, those subsidies are gone. And so we know that 1 million people will be without those subsidies. We are also aware that again, I sit at the intersection of mental health and education. And so we have been doubly impacted in so much as those school districts that chose not to sign the DEI mandate from the Department of Education, those schools, there was $9 billion of funds withheld from those schools. And the services that we provide do fall under supportive services for many school districts, and they would typically charge Medicare to get back some of those funds. So oftentimes when you are providing behavior support services in the school system, the schools are able to charge Medicare for those services. And there has been some redefining on how to get reimbursed for Medicare. So as it relates to those particular policies, I'm hyper aware that students have been impacted at every level. So whether your parents are, going to work every day and they are buying insurance through by way of the marketplace, or you're receiving subsidies, the population that I am hyper focused on, they have been impacted. Um, both by way of the services that they would get at school and the services that they'd be able to access by way of insurance.
Thank you. I see, I think Ziamara had her hand raised, so we'll take this last question or comment and then we'll move on for the sake of time.
Thank you so much. I just wanted to, I also live at the intersection of mental health and education. So my first thing was, are you connected with school counselors and community schools coordinators? And then also the Maryland School Counselor Association has been doing a lot of, they have a lobbying firm now, so they are doing a lot of that tracking of certain policies. So they may be another great partner for you. And then lastly, here at Bowie, we have the Ujima Center for School Counseling Scholars. Thanks to this administration, that funding is ending at the end of this year, but I know the center director, Dr. Nikki Ham, is already getting other sorts of funding, but the mission and values are right in line with what you're doing. So I'd love to connect with you to just kind of bridge you with some people that are really doing similar work that I think could be really beneficial partners within Bowie and within the state. But school counseling is my jam, and that's who you need.
Yeah.
Thank you. I appreciate that. I am a Bowie-based business, so I will definitely be reaching out to you.
Absolutely.
That's fantastic. I love all the connections. Thank you so much, Dr. Blount and Dr. Coleman, for sharing a bit about your organizations today. And let's see, okay. Yep. So I just want to thank you all really just for signing up for these partners and focus segments. In fact, everybody signed up. I think we only have 1 month that didn't have any signups. So if you're interested in taking 5 minutes to just share briefly about your organization, I think we have 1 or 2 spots open in December. So go ahead and you can click this link. I'll make sure the slides go out. And then you can sign up for December, and I'll make sure to follow up with you about next steps and things like that. So thank you again, Drs. Coleman, Dr. Blount. We really appreciate you, and we look forward to our Partners in Focus next month. All right. We are now going to have the pleasure of hearing from Dr. Sandra Aljami, and I'm going to ask Ms. Nina Ward to give our official introduction.
Absolutely. I am honored to present Dr. Aljami, my colleague at the Behavioral Health Division. She is an LCPC. She currently serves as project director of our System of Care grant in Prince George's County, a $4 million 4-year grant program funded by SAMHSA for participants 0 to 21 years of age. The grant works really collaboratively with community partners, designed to promote health awareness, disease prevention, and the general well-being of the public. So Dr. Aljami will present on systems of care.
Good afternoon to the BHAG members. So nice to meet some of you and catch up with many others on this mental health journey. So good to see you in the chat, in the room here. So I want to start out by, we can go to the next slide. What is the system of care? So when we think about the system of care, it's really a model, a coordinated model for a community-based approach that organizes services and supports for children and families with complex needs by building partnership across agencies, schools, and the community to provide family-driven, culturally competent, and individualized care. And the goal is to improve outcomes by providing effective, integrated, accessible services in the least restrictive environments, ensuring a comprehensive array of services is available to meet the diverse needs of children and their families throughout their lives. We have a 4-year, $4 million grant to implement in some areas and expand in others. Again, there's a special focus, and that's on improving the mental health outcomes for youth and children from birth to 21 years old who are at risk of entering the child and welfare and juvenile systems. Just want to say that the system of care has core values, and 4 of them are family-driven and youth-focused, community-based, culturally and linguistic competent, and interagency collaboration. Okay. Next slide, please. So our intended purpose really is to make sure that the children are prepared to transition into adulthood. So, research has noted that early intervention and early identification and early intervention prevents crisis and reduce involvement in the justice systems, welfare systems. Children and youth achieve better long-term academic health and social outcomes. And there's a minimized emergency room visits and hospitalizations. And it's family-centered. Interventions are more effective than treating the child in isolation. The goal is to strengthen the community and promote equity in care and to build healthier, more resilient families and communities in Prince George's County, ultimately reducing long-term social costs. Next slide, please. So here we have our concentric model. And when we started this grant, we're looking at it from the prospect of the target population. Again, birth to 21 years old. And this demographic often includes those in and transitioning out of child serving systems such as foster care and juvenile justice. Also, those who frequently face challenges related to mental health conditions and substance use disorders and homelessness. And then we look at the community impact. And that is to be a bridge builder, implement and oversee programs that align with SAMHSA goals, and to manage daily operations by building partnerships and coordinating across child welfare and behavioral health, and more importantly, providing a platform for the youth and family voice to ensure services are family-driven, youth-guided, and culturally responsive. Then we have the collective impact model. So in the collective impact model, that is where we establish linkages to care by focusing on collaboration and community-centered solutions. And the aim is to build a stronger, more responsive healthcare ecosystem that better meets the needs of our residents. So the collaborative goal is to develop effective integrative strategies that unite healthcare providers, behavioral health specialists, and the social and community organizations. And this goal is to create a unified network of support that promote healing and builds fair and equitable social determinants of health outcomes for future generations. I would say that the beauty of the collective impact model is that it reduces duplication of efforts and it leverages diverse resources and expertise, and it builds stronger community trust and engagement, and it increases the sustainability of solutions through systemic change. And then we look at our internal vendors. So we have clinical providers, and we'll talk more about that, clinical providers, support providers. And the benefits of that is that a strong internal partnership, it helps to build and enhance all aspects of care by coordinating these efforts across different agencies where services become more seamless to the residents. And then we have our external partners. So in our external partners, there is a need, and that's part of the ask today. External partners are essential because they help address the complex factors that influence a child and family's well-being beyond the formal service agencies that we have with the internal partners. Next slide, please. So here we have a lot. when we're looking at the strategic direction. So when this grant started, when it was first proposed, the goal, our strategic direction was to make sure that we establish community-based, youth-guided, family-driven, and culturally competent partners. And we have done that part of the work, and to provide evidence-based practice training opportunities. That part we have done as well. So we're well on our way to the midpoint of this grant, and establish a referral pathways. And that's something that we have done. Also, when it comes to reducing barriers such as stigma and transportation, these are the kind of things that are supported by this grant for the partners, and making sure that there's access to behavioral health support. And we have a targeted media campaign that looks at behavioral health in Prince George's County. And there's a lot of media, whether it's radio spots, on-site talent promotion, local, regional influencers, where youth create the content. It's on the podcast, social media, digital opportunities screaming, because most of the spend for media, when it relates to youth, it goes to digital social podcasts. That's where they actually spend their time. And radio, that builds community engagement, and it also meets the parental reach. And we have it in Spanish language for minority owned media to ensure cultural representation. And then we have the ensuring vulnerable youth populations. We want to make sure that we are working with the youth, providing support to the youth, and providing partners that are culturally sensitive to the youth and that allow them to have a voice to be a part of all of the care. And we also are developing partner capacity to serve children at risk from 0 to 6. All of this work is done from a trauma-focused platform and approach. Next slide, please. So here are our partners. I talked a little bit about the partners, our internal partners. We have the clinical grant partners, and we also have family and youth supportive grant partners. And we have the University of Maryland, which is our evaluation team. And then we have key internal referring partners. And as such, the juvenile justice, social services, the public schools, truancy reduction program, local care team, and healthy transitions youth council. The next slide, please. I talked a little bit about the training. So we developed a training blueprint, and this blueprint addresses the complex trauma. The training really focuses on making sure that the youth, all of the providers understand that the youth voice is one of the most important voices in this work, and understanding how the training and how the services are going to be the youth are going to be impacted by that. And also looking at providers are culturally competent in the services that they're going to provide, and that there is training around how to make sure that the skills and the coordination of services to the youth are systemically appropriate for the youth. And just making sure we demonstrate a pathways, that it's strength-based, that we're working with the families, the LGBTQ community for youth, and the families are, how the families are affected. We want to make sure that there's safety and planning interventions. All of those things we took into account when developing a training blueprint for the providers that are providing services. And it's not only the providers that are providing services, we open this up to providers in Prince George's County, because we don't just want to focus on the ones that are part of this grant. We want anyone that's providing services to this population to be able to have this training for free. Next slide, please. So I said a little bit about the referral pathways. So here is our referral pathways, where you can go on and you can make a referral for services or that your agency might need. And this is the landing page and the QR code. It'll take you directly to the referral source. We also helpful tips. Sometimes we get persons that don't know that they're being referred. So we just want to make sure everyone knows that they're clear with their participants that they're going to be referred, and make sure if you're using multiple providers for one client use separate referrals, and is a space that you can upload any supporting documents. So right on the behavioral health, Prince George's County under system of care, this is the way to get to the referral source, and you can go there and see any information we have, who our providers are, and the services that they provide. Next slide, please. So in starting this work, put together a targeted projected targets. And this is just for year 1, year 2, through all the way through year 4, and said that we will reach a total of 350 unduplicated individuals to be enrolled in services. So the 29th of this month will be the end of 2 years, and we'll be starting the next, the 3rd year of a 4-year grant. So the next slide, please. So here's some targeted goals and outcomes, and where things that we said we would do was encountered through program outreach. We have our targets for year 1 and year 2. As you can tell, we have surpassed the targets by a great deal when it comes to referrals and enrolled annually and receiving evidence base. This information, these numbers are through July. We still have 2 months worth of data that's not in here. But even though we have surpassed our targets, we know that there's a lot more youth inside Prince George's County that could benefit from the services. So it is the hope that we increase every metric on here so that we can broaden our reach to those who could benefit from the services. The next slide, please. So the community impact, one of the things we wanted to do was to make sure that we had clinicians that spoke Spanish and other languages, that we utilize the language line. Another part is, and previously we received probably 90% of the referrals from DJS, where at one point providers didn't have a direct access to DJS with the clients, and now they do. And here's an opportunity to work with clients that may not have wanted to take on the services, or maybe providers didn't want to take on the services because they were from juvenile justice. But I think with the partnership that we have and understanding and putting the needs of the community and the youth first, that it's been a great experience. Our goal for this community impact is we have a seamless linkage to care with a warm handoff to the providers. And we're consistent communication with the youth, the providers, and we have evidence-based training, evidence-based practice training on June 24th. I know there's a few people on here that have signed up to attend. We are launching June 24th, we launched the Complex Trauma series, Complex Trauma One-on-One. We launched September 11th, we launched the 18-month child-parent psychotherapy learning collaborative. And on September 30th, we'll be launching the trauma-focused CBT learning collaborative. Just want to highlight for providers, in 2 hours, I put out a call for training, and in 2 hours it was filled up. And it was 38 people on the wait list when it comes to trauma, and when it comes to focusing on immigration. We have a special series on immigration. And lastly, we'll talk about the GOAT. This is the 5th year that the GOAT Expo is a platform. Well, this is in partnership with VOA, Volunteers of America, and Bowie State University, and is a platform for community providers to for community providers to present their services and to receive updates, for the youth to receive updates on mental health stigma and all types of services that are being offered. The next slide, please. So external partners. So today's ask, how might you be able to partner with us in service to the youth of Prince George's County? So what we need youth to increase their voice in the youth council. We have a youth council that meets every other month. It's comprised of and led by the youth in Prince George's County. We need to attend the core meeting. We need youth and parents representation. We want their voice. We want them to perform or get into the group of advocacy. We need referrals. Like I said, the work does not stop with just the internal partners that we have. We know that there are a lot more youth. We know that there are a lot more agencies that could provide referrals so that youth can receive these services. And we just need help getting the word out. Partner with us. There's a UR code. If you are able to partner with us or want to tell us a little bit about your agency, you can use the UR code and it'll take you to a quick 6-question link and we'll be able to get back to you. Thank you. The next slide. Thank you. I don't know if there's time. I'll take questions if there's time.
Yeah, absolutely. We have about 5 minutes for questions. Feel free to use the chat box or to unmute yourselves and speak.
Yeah, can we go back one slide so that I can get that QR code, please, Shanae?
Yes. Give me 1 second. There we go.
Thank you, ma'am. I appreciate you.
Jennifer, do you have a question?
Hi, I do. I love the presentation on the system of care, and I'm curious about the QR code on the last screen to become a partner. I'm here with Shepherd Pratt today, and Russell Claver Obina is the clinic director. We have a new OMHC in Prince George's County, and so I was wondering if the form to become a partner with SOC was for treatment relationships or it was for referrals of youth. Can you clarify that last?
Yes, thank you. Thank you for bringing that up. It's to establish more external partners. We want to develop more relationships so that we can work with other agencies that are willing to provide services to this to the youth. Absolutely.
Wonderful. Thank you.
Mm-hmm. You're welcome.
Question. Any others? I don't see any in the chat either. Okay, well, that's all right. Thank you, Dr. Aljami. This is a great presentation. You all are doing great work. I see a comment from Carmen. This program is an excellent program for the youth that has been referred to Teens Court and their parents. Teens Court need to be complemented with this program. Teen Court is a referral program of the juvenile services.
Thank you.
Lots of opportunity for partnership. All right. Well, if no other questions or comments, we will go ahead and move on to our community announcements. For our presenters today, if you haven't already and you're open to doing so, please feel free to include your contact information in the chat box for anyone who may have some follow-up questions or may want to contact you to further extend these partnerships that we're working towards. All right, so our community announcements. So as many of you know, as a coalition, we are encouraging our families to attend the Prince George's County Health Department back to school vaccine clinics. They are continuing through the end of this month, so that's September 27th, at various locations throughout the county. So the flyer is here. The link will also be available after the meeting. I think there's just a couple left, so or maybe just one left. So if you haven't gotten your kids vaccinated, this is the time to do it. The Walk to End Alzheimer's is almost here, so we ask that you all join Prince George's County Healthy Revolution team this Saturday, September 20th, at the National Harbor to help raise awareness, support caregivers, and to help fund Alzheimer's research. Registration does start at 8:30 a.m. and the walk begins at 10. So bring your comfy shoes and your water and get ready to move while supporting a great cause. The registration link will be available. Hope House is a proud sponsor of 100 Black Men of America's Breaking the Silence, Black Voices on Suicide and Survival. Please join them on September 24th at 6 p.m. They're moderating a Zoom panel discussion to examine really just the factors that contribute to the alarming rise of suicide among Black men. They're going to break down barriers to prevent them from seeking mental health care, and talk about some of the cultural stigma that exists in the community. So if you are interested or know someone who might be interested in participating, the registration link will be on the slide. Prince George's County will also be having their 2025 Family Caregivers Conference on Thursday, September 25th from 10 to 2. The registration link and flyer on this slide, so I'll make sure you have that. This event is taking place at Martin's Crosswinds in Greenbelt and is open to those who care for older adults or individuals with Alzheimer's disease or related dementia. And just a note that they asked me to highlight that registration is required due to limited seating. All right. MedStar Health Diabetes Support Group. They are launching a safe space to support individuals and families that are affected by diabetes. Their goal is to promote health coping strategies, to enhance self-management, and to foster meaningful relationships with providers as well as other fellow members of the support group. So they meet every third Wednesday of the month from 11 to 12. So if you are interested, please feel free to join this support group. MedStar is also inviting us to join their advisory task force meeting for the MedStar Southern Maryland Hospital Center. Their ATF brings together community and partner resources to support the implementation of their Community Health Needs Assessment, or their CHINA. During this meeting, they are going to review their implementation plan. They're going to highlight some of the progress that they've made so far and explore opportunities to build and strengthen community collaboration. So they are meeting virtually on the 29th of this month at 4 p.m. So the link will be provided. Parks and Rec is celebrating pedestrian safety, health, and community options for the month of October, or as they call Walktober. There's going to be a variety of events for all ages for our fellow Prince Georgians to attend to get moving. So please visit their website, or you can check out this flyer that's available for a list of events that they are sponsoring. They are also going to be observing Mental Health Awareness Week between October 5th through the 11th. They ask that you visit their website to learn more about mental health resources in Prince George's County, and to gain more knowledge on how to take better care of your mental well-being. They're going to have free workshops, different trainings, and some fitness classes. So if you're interested, please join. Celebrate Maryland Walking Day by walking or rolling a few laps through the park on the beautiful loop trail at Tucker Road Community Center in Fort Washington. This is going to be on October 1st at 4 p.m. You can register to attend, and they're going to have some urban line dancing classes and then a guided walk around the trail. So if you're interested, please join. Girl Group will be hosted by Presley Counseling and Wellness to offer a safe and supportive space for young girls to build confidence, resilience, and connection. There will be guided discussions and a bunch of different activities for the young ladies to participate in. And this will take place on October 4th at 12:30 p.m. The flyer is on the slide, and I will make sure you all have that as well. Medicare open enrollment. So we are excited to share information on this upcoming open enrollment event. It is hosted by Prince George's County State Health Insurance Program. This is going to be a wonderful opportunity for people to learn about their Medicare benefits, how to complete a benefits package. They can receive one-on-one assistance and explore different ways to save on healthcare costs. So this event will be taking place on Friday, October 10th at 10 a.m. at the Health and Human Service Building. So please feel free to register at the link provided and share with your colleagues and friends. Also with Medicare, Dr. Gaskin, he is the director of the Hopkins Center for Health Disparity Solutions at Johns Hopkins University Bloomberg School of Public Health. That is a mouthful. But he is looking to speak with Black Medicare beneficiaries. They're doing a 30-minute phone interview to really just gain a better understanding of what influenced their health plan selection. So if you or someone you know might be interested in participating, please feel free to share this flyer with them. And there will be a $25 gift card incentive available to those who participate. One Future, One Voice Youth and Prevention Town Hall will be hosting a town hall event, in honor of National Substance Abuse Prevention Month. So this is being hosted by Therapeutic Links. It's Saturday, October 25th at 10 a.m. to 2 p.m. And essentially this event is going to just bring together youth and families and prevention partners. They are planning for an interactive day of learning, some dialogue, some community connection with informational tables. They're going to have a youth-led town hall discussion and some other family-friendly elements like raffles and giveaways and other interactive activities. So if you are interested, please feel free to join them. The American Heart Association is hosting their Heart Walk on Saturday, November 1st at the National Mall. So please feel free to register to join this family-friendly 1 to 3 mile walk for a great cause. So a lot of movement this month, right? It's really cool. And then last but not least, the health department is hosting a virtual DSMP or diabetes self-management program. This cohort starts November 1st, and they're going to meet every Monday online from 4 to 6 p.m. So if you or someone you know is living with prediabetes or type 2 diabetes, please consider registering for this free informative class. And you're going to learn ways to just enhance living with and managing your diabetes. I know that they create and help implement action plans. It really is a great program. So I encourage everyone to participate if you can. Registration is required because space is limited. So I know that was a lot of announcements, but as you can see, our county is busy and busy in a good way. But I just want to open the floor for anyone else who might have any additional announcements that they might want to share at this time. Anything in the chat? Okay. If anything does come to mind, I will ask if you could just send me those flyers or the information by noon tomorrow, because I try to get the meeting minutes and the recording out within 24 hours as best as I can. So please feel free to, if anything else, like I said, comes to mind, just send that along to me. There's a question, is this support group only for English speaking individuals? Is this for the diabetes self-management class? If so, yes. Okay. If so, I believe it is at this time, but I will follow up with Taylor to see if there are any plans to host any bilingual classes. How do I get on the distro for the meeting minutes? Jennifer, feel free to send me an email and I'll make sure to include you. You're very welcome. All right. Well, hearing no other announcements, if nothing else, I will remind you that our next monthly meeting is going to be on Wednesday, October 15th at 3 p.m. Same time, same place. So I look forward to seeing you all at the next meeting. We had really great presentations. So again, thank you to our speakers today. Thank you so much for just all the great work that you're doing in the county and for sharing it with us. And again, if there's anything that we can do to further support you, you can feel free to reach out to me or to the work group via email. We'll be happy to do so. Thank you, everyone. Have a great afternoon.
Thank you. Take care, everyone.
You too. Bye-bye.